You know, we all deal with pain, right? It's just a part of life. But what if we've been looking for the solution in all the wrong places? Today we're diving into a really powerful idea. What if the key to managing your pain isn't actually in your back, or your knee, or your head, but inside your brain itself?
And this is the core concept from Dr. Daniel Amen. It doesn't matter where you feel that ache or that sting. The experience of it, the suffering part, that's all processed and interpreted by your brain. Just getting that one idea that pain ultimately lives in your head, that's a massive shift in perspective that can change absolutely everything.
And if you're skeptical, get this. This is an incredible statistic. A full 80% of people over the age of 70 who have abnormal-looking backs on an MRI, they feel zero pain. None. Their scans clearly show physical issues, but their brains aren't creating a pain experience. It's a huge sign that what a picture shows and what you actually feel can be two totally different things.
So this shows us that pain isn't just some raw signal firing off. No, it's an interpretation. It's a story that your brain is weaving based on that signal. And if the storyteller, your brain, isn't healthy, well, that story can turn into an absolute horror show, amplifying the pain way beyond the actual physical sensation. So the health of your brain is everything.
Okay, so how does the brain actually do this? How does it build this whole story of pain? Well, it turns out it happens along three very distinct pathways in your brain. You can think of these as the secret headquarters for pain.
All right, first up, we've got the lateral pathway. This is kind of like your brain's GPS for pain. It involves areas like the thalamus and parietal lobes, and its whole job is to tell you where it hurts. When you stub your toe, this is the pathway that screams, "Ouch!" right there on the pinky toe. It pinpoints the location and that raw initial sensation.
But then comes the medial pathway, and this is where a simple ouch gets a whole lot more complicated. This is the circuit that adds the emotion to it, the dread, the anxiety, that feeling of, ugh, this is awful. And here's a really crucial piece of the puzzle. This pathway is often way overactive in people with depression. It really helps explain why emotional and physical pain feel so connected.
And then, thankfully, there's the calming pathway. This is located in your prefrontal cortex, and it's basically your brain's own built-in pain management system. Its job is to act like a set of brakes, to settle down both the ouch signal and that suffering signal. So you can imagine, if this area gets damaged, say from a head injury, it's like the brain's brakes are cut. The pain signal just feels relentless.
So, there's the sequence, right? First you get the ouch, then your brain adds the suffering, and then, hopefully, the brakes kick in to calm it all down. But what happens when this whole system gets hijacked and starts working against you?
Well, when that system gets hijacked, it can create this awful, self-perpetuating cycle, trapping us in chronic pain and suffering. Dr. Amen has a name for this. He calls it the doom loop. Now, before we break down that loop, it's really important to understand what makes someone vulnerable to it in the first place. And this leads to a question that honestly sounds like something out of science fiction. Can the choices you make today actually affect the brains of your future grandchildren? The answer, shockingly, is yes. And it's all thanks to the science of epigenetics.
I mean, check this out. In a recent study, mice that were given aspartame became anxious. Okay, no huge surprise there. But here's the wild part. Their babies, who never touched aspartame, were born more anxious. And so were their babies. Our habits can literally flip genetic switches that get passed down, predisposing future generations to things like anxiety, which, remember, is a key driver of that suffering pathway.
And it's not just what we consume. Adverse childhood experiences also physically change the brain. Trauma can turn up the volume on that medial suffering pathway and make it oversensitive for life. It basically pre-wires someone to fall into that doom loop much more easily.
So let's look at exactly how this spiral works, using Dr. Amen's acronym, PAIN HQ. It starts with P, for pain of any kind. This activates the suffering pathway we talked about, which leads to I, an invasion of negative thoughts. This, in turn, creates N, nervous tension and even rage, which can push you toward H, harmful habits just to get some relief. And all of this traps you in the Q, the quicksand of suffering, which just creates more pain, and the loop starts all over again.
Okay, that sounds pretty bleak, I know. But here is the really, really good news. Just as there's a loop that can trap us, there is a path to get out, a healing loop. So, how do we break the cycle? Let's get into the actionable steps.
The big difference is this. The doom loop is all about automatic negative reactions.
The healing loop, on the other hand, is a conscious, proactive path. It requires a really important mindset shift from being furious about your pain to getting curious about it. It's about asking, why is this happening, instead of just suffering through it.
One of the most powerful tools you can use like right now is diaphragmatic breathing. It's so simple. You just breathe in through your nose for 4 seconds and then breathe out slowly through your mouth for 8 seconds. This simple pattern instantly calms your nervous system, it improves your heart rate variability, and it can literally stop a panic attack in its tracks. It's a direct override for your body's stress response.
Now, some pioneering doctors believe that chronic pain is often just a physical manifestation of repressed rage. A really powerful way to start digging into this is through journaling. Try this. Map out your life in 5-year chunks. For each block of time, list the positive things that happen on one side and the painful or negative events on the other. You might be surprised by the patterns that start to emerge, revealing where some of that hidden emotion might be coming from.
And there are natural tools that can help too. Saffron, for example. Dozens of studies have actually shown it to be as effective as many common antidepressants, but without a lot of the nasty side effects. It seems to work by calming down that medial suffering pathway, which helps to decrease both emotional and physical pain. So, we've gone through the brain's pathways, the doom loop, and some really powerful healing strategies. But after all that, it really all boils down to one simple, guiding question you can ask yourself every single day.
And here it is. Just ask yourself, is what I'm doing right now good for my brain or bad for it? By asking this one simple question about the food you eat, the thoughts you think, the habits you keep, you shift from being a passive victim of your pain to being the active creator of your own brain health. And when you change your brain, you truly can change your pain.